So at IHME, you guys are kind of like a data center. The data comes in, so you have a unique perspective on what's going on in the world. Can you share with me some of the problems that you're most concerned about at IHME?
Unfortunately, we have a lot to be concerned about when it comes to health. Still in the year 2019, there's a big unfinished agenda in the infectious diseases and maternal conditions. And then depending on where you look across the world, there's also a very large burden due to non-communicable diseases. So I'll take maternal and child health as an example. So even though we have made remarkable progress since the 1990s, there's still about 5 million child deaths a year and about 200,000 maternal deaths a year.
What do you think it would take to make the trend lines more positive in this area?
I think it would take holistic interventions. So we know how to make progress on both maternal and child health, and some of the ways in which we can improve health outcomes are by health interventions, but there are also more upstream interventions like investing in education of young girls and women and keeping them in school that also contribute to both reductions in maternal mortality and child mortality. So if we took a holistic approach to the problem around the world, I think we could make a lot of progress.
Bill?
One thing that comes to mind for me is obesity. So we put out a paper a couple years ago that was very revealing to say that it used to be that the world suffered from lack of nutrition. There were millions and millions of kids basically who were suffering from not getting enough to eat, and now instead that has been surpassed by people eating too much. So now it's a much bigger health threat to eat too much and to have a high body mass index.
So, I mean, a lot of eating habits are related to behavior change. So do you guys have any ideas about the most effective ways to actually go about combating obesity?
The challenge with obesity is that there is no country that has actually made progress on it. So we don't have a success story to point to. We see trends rising in high-income countries, but also very disturbing increasing trends in obesity around the world. So a lot of lower and middle income countries also are seeing huge rises in obesity, and we're seeing no country that has actually managed to bring the proportion of the population that is overweight or obese down in a successful way.
It's really shocking for me to hear that, because I don't think it's a problem that we've all heard about in the news, but to think that there's no progress being made anywhere is not something that I knew. It means that we're going to need a lot more ingenuity, and I wonder where that ingenuity is going to come from. You guys have any ideas about, you have any hopes about who could lead on this particular area?
Well, what you've started to see happen at the local level are attempts to have calorie counts in restaurants, attempts to maybe limit portion size. There's lots of things being tried out there, and it hasn't happened at scale yet to see if there's been an impact. But there definitely are efforts out there. And the thing is, it isn't just about what you eat that's bad for you. It's also about what you don't eat that contributes to poor health. So if people could get more fish in their diet, more nuts and seeds in their diet, more fruits and vegetables in their diet, more whole grains in their diet. So it isn't just about cutting out sugars and fats and salts.